We have a COVID pandemic. For me, that's an acute one. And I often talk about a lobster. It's as if with COVID, a lobster was dropped into boiling water. It's dying and it's making a dreadful noise. But at the same time, we have a slow pandemic happening. And this is the pandemic of antimicrobial resistance, drug-resistant bugs. They can be bacteria, viruses, anything that causes infection. So parasites, fungi, they're not responding to standard treatments. People are dying across the world. We have to take action because it's like a lobster put into cold water. It's heating up very, very slowly. It's not making a noise, but golly, with this slow pandemic, people are dying and a lot more are going to die. We've worked hard, particularly from Britain, with the World Health Organization, so there's a global action plan. And we in Britain have got a national action plan, actually our second. And we're really working to reduce the amount of antibiotics used, both in the food chain, where they're doing really well, particularly in chicken farming, and for human use. And our GPs have done a great job to date. But there's more to do, because about 1 in 4 prescriptions at a minimum are not needed. We know antibiotics don't work if you have a virus infection. We can all take action. We can prevent infections by getting our vaccinations, washing our hands, and during COVID, wearing masks. We can take action as consumers. Do you check whether the fast food chains you go to use food, meat, where growth promotion has been used by antibiotics? That is wrong. Shake Shack's safe, and actually McDonald's have agreed to remove antibiotics for growth promotion by the end of the year. We can also work through our pension funds, our endowment of Trinity and other things as investors to make sure our food chain is using antibiotics and anti-infectives properly, doing infection prevention and control properly, and that pharma companies are developing new drugs. Because actually we've got a very empty medicine cabinet for new treatments, new diagnostics and new vaccines to fight AMR. We need all of this. I care about this. It matters to me about superbugs, but I really care about it for the young. This is your generation's problem, though my generation did it to you. You need to protect our drugs and fight the bugs.
Hey folks, my name is Giles Yo, and I'm a research scientist based at the University of Cambridge. And I want to raise this issue of antimicrobial resistance. This is the increasing likelihood of a number of different bacteria becoming resistant to antibiotics. Now, this is a big problem. If you were immune compromised and you ended up in hospital, say, and then suddenly you got infected by one of these superbugs and the antibiotics no longer work, well, you don't have to have me tell you that that's just not a good thing. Now, I may be a geneticist studying body weights, but I did spend a little bit of time as an undergrad looking at the genetics of an antibiotic-resistant bug called Pseudomonas aeruginosa. And we want people to protect our drugs to fight the bugs.
My name's Chris van Tullikien. I'm an infectious diseases doctor at University College Hospital in London, and I'm an academic at UCL. On a day-to-day basis, I haven't really noticed the increase in resistant organisms. But if I go back and look at notes or have a think about what resistance results looked like when they came back from the lab a decade ago, they were dramatically different. So we used to get that string of S's that indicated that a bug was sensitive, and now it's very normal to just get a row of R's for resistant. And we treat patients with even relatively minor infections with drugs that we wouldn't have considered using even a few days ago. So in clinical practice, the problem is becoming acute and very, very real. I also teach undergraduates who are not clinical, who aren't medical students, about antimicrobial resistance. And that gives me a sort of wider perspective beyond the vital work of the sort of stewardship of antibiotics, taking care of antibiotics in the hospital. We know that lots of the drugs that we use in the hospital were actually used in animals. They were licensed in animals before they were licensed for use in humans. And they were used in animals to promote growth for many, many decades at the low doses that are perfect to promote the evolution of resistant organisms. So when you couple that usage with the intensive farm systems that we've seen increase the risk of pandemic disease, we have a perfect storm for creating this extra pandemic of antimicrobial resistance. So just as our food supply system leads to the development and spread of antimicrobial resistance, so the way we manufacture antibiotics also promotes the development of resistance. If we look at some of the industrial zones, particularly in South Asia, where major pharmaceutical companies produce most of their drugs, there are lots of studies showing samples of sewage water with 20 times the therapeutic level of antibiotics and antimicrobials that you would need to find in blood. We know that the release of antibiotics from some of the factories that make them on a daily basis is equivalent to the use for entire countries in Europe. Many dozens of kilos per day, enough to treat medium-sized towns for a week. So the manufacture of antibiotics is a huge problem. And a lot of my research now focuses on commerciogenic disease. So that's diseases caused by profit incentives. And the deaths that we see at the moment, and we're going to see far, far more of them in the future, from antibiotic resistance are as surely caused by profit incentives as the deaths that we see from incorrect use of infant formula or from tobacco products or from alcohol. These are problems caused by profit. They're the profit of the food supply system. They are the sloppy, poorly regulated manufacturing processes. And of course, the reason we don't have lots of novel new agents is because of the structure of our pharmaceutical supply system, which isn't benefited by drugs like antibiotics, which are used to treat for short courses in low-income populations. And of course, they have to be often hoarded away from the market when they're first invented. So I think that antimicrobial resistance is a threat that is arguably almost as great as the existential threat posed by climate change. Protect our drugs and fight the bugs.
We've all experienced what it's like to live through one pandemic. Let's not bring it upon ourselves again. Go to Trinity AMR Action Group for more updates.
Protect our drugs and fight the bugs.